Hey everybody, this is Jason here, West Volusia CPR LLC and westvolusiacpr.com. Coming to you today with our first video of a long line of videos that we expect to put out to help you both in your CPR certification training and your everyday clinical or non-clinical life. Today's video comes to you about basic airway management. I get this all the time. Anyone who doesn't know me knows that I've been a nurse for a decade and a half now. Most of that time I've worked in cardiovascular intensive care unit, which in ICUs we get used to a lot of advanced airways and techniques. And I see a lot of people, especially on my less experienced side of nursing, tend to forget it really always comes down to the basics of what we do. That's why basic life support is the foundation for everything else that we do in American Heart Association. Basic airway management is everybody's responsibility. I don't care who you are. So let's get into it. To start, we're going to just deal with positioning the airway. You cannot breathe if you don't have an airway. If you don't have an airway, you don't have a patient, okay? You don't have an individual to resuscitate. So the first thing we always do is you've got two different options. You've got the head tilt chin lift, or you have the jaw thrust maneuver. And when we're talking about the head tilt chin lift, I love to say it's more about the lift and less about the tilt. So if I was to do a head tilt chin lift maneuver on someone, simply from the side is one option. I'm just going to simply two fingers on the bottom of the jaw and one hand on the forehead, and I'm just going to gently tilt but more emphasize the lift. This way you can get all those nice relaxed muscles up and out of the way and help open up that airway. If your victim is not breathing very well and it sounds more like, come on, all of us in clinical know what obstructive sleep apnea is, and a lot of us outside understand what sleep apnea is. And ladies, if your husband snores, husbands, if your lady snores, all right, give them a little nudge, give them a little head tilt. They'll probably wake up wondering what the heck's going on. But nonetheless, head tilt, chin lift. Next time someone's snoring, practice it. You'll see how well it works. Okay? Head tilt, chin lift. The other alternative is what's called the jaw thrust technique. A jaw thrust technique is required in any situation where you have a person who doesn't have a good open airway, but you're concerned over a head or neck injury. We do not want to move them. We do not want to risk paralysis or further injury. So how do we make that happen? Easy. Easiest way, in my opinion, is to start up here at the head. You're going to come down, you're going to place two thumbs on the cheekbones, okay? Then you're going to place one or two fingers behind the jaw, right here, behind the jaw, the corner of the jaw, corner of the mandible. You're going to gently push down on your thumbs on the cheekbones, and you're going to simply pull that jaw forward, okay? And all you're going to see is something like this. You're going to see the jaw jut forward, and then you should not hear. You should hear something clear, more open, and see more visible chest rise. All right, so that's basic airway management. Now let's get into actually providing breaths for someone in the event that we're doing CPR. I like to start out with the pocket mask first. Okay, the pocket mask is any kind of device, usually comes collapsed, usually comes with a valve, okay, that you're going to use in the event that you're doing CPR on someone you don't know. And if you have it and you do know the person and you know their medical history, I still recommend using it. It just helps you to make sure you get a better seal, okay? So the one thing that we always want to do, and I'm going to turn a little bit here, okay, is you always want to place that mask between you and the victim. And you always want to place it with the pointy part facing in the direction of the top of their head, okay? So when you go to grab it, you're going to grab it in a way that you can simply place it on the bridge of the nose as a guide. So you don't place it too high, too low, too right, too left. Just place it. Then lay it down flat against the head and turn your hand as you do, so your finger, index finger and thumb are the only two things placing pressure on that mask. The rest is resting gently on the forehead. Then you come in with the other hand on the bottom of the jaw and place your thumb, hear that? Place your thumb on the hard plastic. So I only have 3 points of pressure. And again, remember what do we do? Head tilt, emphasis on the chin lift. Okay? That's how we place a pocket mask. Last but not least, we have the bag mask device. They come in all different shapes and sizes. Okay? but the point of the matter is they're all used the same. At the head of the patient, and you're going to use what's called an EC technique. EC technique. Take the mask, just like the pocket mask, point it on the bridge of the nose, lay down to the chin. Now, to help everybody else who's uncomfortable with these and not practice, this is some tips, okay? Lay your hand completely flat against the face. All right, don't be up here and all rigid and firm and stiff. It's not gonna work. You gotta be loose, you gotta be relaxed. Lay your hand against their face. If you ever wonder how much downward pressure to apply with your thumb and finger, let go of the bag. As soon as you do, you will naturally clamp down with downward pressure. Watch my fingers here. You'll clamp down with downward pressure and create a good seal. Now remember, it's all about the what? Head tilt, chin, lift. So let's take these 3 fingers here and really aggressively lift and pull that jaw up in that mask. And then we're going to give 2 breaths, looking for that chest rise. All right? Every breath, I don't care how you're doing it, mouth to mouth, face shield, pocket mask, bag mask device, bag to endotracheal tube. Give 2 breaths, 1 breath over 1 second apiece, no faster. And look at my hand, just enough to see chest rise. I am watching that chest the whole time. I'm not going, okay? You're gonna cause significant injury. Any questions? Good, I didn't think so. There's a video. If you do have any questions, you can feel free to email us. All right? 2 breaths, 1 second apiece, just enough to see chest rise. Now, you may say, hey Jason, that's all great for CPR when we're in resuscitation, but you're talking about a person who's not breathing very well, okay? So a person who is alive and is breathing, even if they're not breathing well, all right, they may still need some help. So American Heart Association says we have something called rescue breaths, all right? Back to the pocket mask. Rescue breaths, 1 breath every 5 seconds is gonna cover you for every single last patient, okay? Every single last victim, from the baby to the geriatric, 1 breath every 5 seconds, okay? So if I was using a pocket mask, it would be breath 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, breath 1,000, and so forth. Bag mask device, the same thing, okay? So key takeaways, always make sure bridge of the nose, pinch the mask tight, open up the airway, give 2 breaths over 1 second apiece, just enough to see chest rise during CPR, or 1 breath over 1 second apiece, just to see chest rise every 5 seconds if your person does have a pulse but isn't breathing well. And it all comes back to the basics. Remember, head tilt, chin lift, or the jaw thrust maneuver. If you have any questions about anything that I've covered so far, like I said, feel free to email us at admin@westvolusiacpr.com. We can also be reached at 386-689-8051. We look forward to hearing from you, fielding all your questions that you may have. If you have any suggestions or recommendations for anything that you might like a little bit more explanation about, feel free to send us a message as well. We look forward to hearing from you. More videos to come in the future. This is just the beginning. So excited to hear from you. And it also, quick thing, just give us a post and a shout out on our Facebook page, which is also West Volusia CPR on Facebook. So look forward to hearing from you. See you on the other side. Take care.